Hi there. In 2024, there were over 10.7 million people affected by tuberculosis globally. Of these, about 57% were men, and 87% of these TB infections occurred in the WHO top 30 high-burden TB countries. These are mainly countries, in Africa, Asia, Latin America. Some of the risk factors for tuberculosis include cigarette smoking, HIV and AIDS, and undernutrition. Despite having effective treatment, TB remains the leading infectious cause of mortality globally, and some of the reasons for this is delayed health seeking. Usually people develop symptoms like cough, fever, weight loss, night sweats, and they just feel like it's going to go away, and by the time they seek medical advice, it may be late. Therefore, we as community members, we have a role to play in controlling the effect of TB in our community. Some complications of TB include TB meningitis, which is tuberculosis affecting the brain. You can also have tuberculosis affecting the spine, causing what we call a vertebral collapse, which is, affecting the protection of the spinal cord, leading to weakness of your lower limbs. TB can also affect the heart and, cause a fluid buildup in the surrounding tissues of layers of the heart, and cause symptoms such as shortness of breath. But another complication of TB, which sometimes go unnoticed, is what we call post-TB lung disease, whereby someone has been diagnosed of TB and treated, tested negative following treatment, but they continue to have certain symptoms such as shortness of breath or decreased tolerance of physical activity. Therefore, for us to control TB, we need to be able to understand what are the risk factors for TB, what are the symptoms for TB, and seek care early so that effective treatment can be started to reduce these complications of TB. Because, like I said, the effects of TB are not just health-wise, but also financial, socioeconomic. Why? Because people who get affected by TB face what we call catastrophic cost related to care, transportation to facilities, and things like that. In addition, when you're sick, you are not able to work. So there is a financial implication on you and on your family, and there's reduced socioeconomic productivity. Therefore, we have a serious role to play in reducing the effects of TB, and WHO has set what we call end-TB target, to reduce the new cases of TB, to reduce the financial effects of TB in our community. But to do that, it will take a collaborative effort, not just for the healthcare workers, but the healthcare workers, the community health workers, the community members, as well as researchers. So if you want to know more about TB, why not just click that plus sign, follow me, ask questions, and we'll be able to, talk more about TB and other infectious diseases. In my next video, I'll be talking about hepatitis B and C. Thank you.